The science that supports these seasonal vaccines go back decades.
We do our very best in science to figure out the best vaccine every year for that changing infection coming our way.
The recommended vaccines for respiratory this season are the flu vaccine, RSV vaccine, and the COVID vaccine.
Those diseases come every year and are very common and land lots of people in the hospital.
Influenza is much more serious than just the common cold. Influenza can cause children to be hospitalized, can cause pneumonia.
The flu virus is really good at mutating.
It is one of the smartest biological things on this earth. It is constantly changing because all it wants is to infect humans.
So the biggest objection I get for flu vaccine is when I've gotten the flu vaccine, I still get the flu. We're thinking about vaccines in the wrong way. If you have the vaccine and you still get a form of the flu, your body has some defense to protect you from ending up in the hospital or dying of it.
RSV presents as a respiratory illness, a cold or a flu or pneumonia-like illness. But in little babies and in the elderly, it can get really severe really quickly.
It can really target the lungs, making then breathing incredibly difficult. There's probably 100,000 to 150,000 hospitalizations for this directly. We lose 10,000 older adults every year from RSV.
Respiratory vaccines will maybe keep them out of the ICU, keep them out of the hospital even.
We really want to make sure that they have access to it and they know about it and feel comfortable getting it.
COVID-19 is still serious. It continues to circulate in our communities.
We're looking at those different types and those different strains that are coming every year.
Even mild cases of COVID illness can lead to long-term effects known as long COVID, which the vaccine can help minimize your risk for that.
The COVID vaccine has really been a miracle in our time. The first year of COVID, before we had a vaccine, I lost 27 patients to COVID in 1 year. After the vaccine, none of my senior patients have died.
With regards to the mRNA vaccine technology used in the COVID-19 vaccine, it has been studied for over 20 years and has been used for research in cancer diseases and others. What the pandemic did was help us accelerate the use and the research to stabilize the vaccine. It didn't create a new vaccine for us, and now it's able to be out there and help us save millions of lives.
Talk to your healthcare provider about vaccines. Prevent the preventable.